Welcome to Ashley's Outpatient program. The intake assessment process is approximately 3 hours long.
When a patient arrives to Ashley for an assessment, they can expect to be greeted by an administrative staff member and have a copy of their insurance card and identification obtained. They will sign a series of consents and releases of information and be provided a copy of the patient handbook. They should be prepared to provide any contact information for anyone that will be involved in their treatment. Examples include a primary care provider, mental health specialist or other medical provider, lawyer, probation officer, CPS contact, or EAP. We'll also ask for contact information for your primary support system or anyone that will be engaged in your treatment.
After a patient completes their registration, the patient will meet with a licensed therapist. During that time, the licensed therapist will work with the patient to complete their clinical assessment. The clinical assessment is going to include an assessment of past and current medical history, education and employment history, substance use history, legal involvement, past and current. It's also going to cover a patient's family dynamics and social dynamics, and that's going to highlight things that are considered barriers as well as supports, and then it's going to cover a patient's mental health, past and current treatment. At Ashley, we offer 3 levels of care in our outpatient treatment facilities. So our highest level of care is going to be our partial hospitalization program, or our PHP, which is a program for our patients who are stepping down from residential treatment, or for our patients who meet criteria for residential treatment but have social or occupational obligations that prevent them from attending residential treatment. Next, we have our intensive outpatient program, or our IOP. So this is a program that is beneficial for our patients who are reintegrating into society. This is a beneficial program for patients who need that additional structure, as well as patients who are looking to integrate into the sober community. So things like 12-step, peer supports, and a sponsor. Last, we have our outpatient program, or our OP program. This is for patients who have sustained recovery, so period of abstinence that has been maintained, as well as linkage with peer support network and a sponsor.
Once the patients complete their clinical assessment, they will meet with nursing to determine any medical needs that they may have, as well as discussion for anti-craving medications or medication-supported recovery. The different medication-supported recovery options that we offer are buprenorphine, Sublocade, naltrexone, Vivitrol, Campril, and Antabuse. What these medications do is they can block the cravings as well as the withdrawal symptoms for both alcohol and opiate use disorder. Once patients have completed the intake process, the final stop will be with our LabCorp technician. We do offer in-house lab collections. The patient will have their blood collected for TB screening, as well as for any chemistries that might be needed if they're interested in medication-supported recovery. They will also have a quantiferon TB Gold, as well as urinalysis collected. Depending on the patient's level of care, frequency of urinalysis can be weekly to biweekly to monthly. All female patients are screened monthly for pregnancy screenings.
It's important to remember that recovery is a lifelong process. The treatment doesn't end when someone stops using or leaves residential treatment. Our outpatient services are designed to follow the patient for at least 1 year after they finish treatment or once they stop using substances. It's really important that a patient prioritizes their outpatient care. It can be challenging because when you go home and you're involving yourself in your family life again, or you're going back to work, that can become the patient's priority. But we want to make sure that the patient puts their recovery first, because without their recovery, they're not going to have the foundation to build their life upon.
For patients who are assessed at our partial hospitalization, or PHP level of care, these patients will typically engage in treatment for 3 weeks at PHP level. This will include at least 30 hours of group therapy while they're in PHP. PHP will also include individual sessions and family sessions. They will also have the opportunity to meet with our nurse practitioner to discuss MSR as part of their treatment plan. And they will also be provided the opportunity for additional case management resources, so linkage with things like mental health, PCP providers, and employment and education opportunities.
Our intensive outpatient program usually lasts about 8 weeks. However, it is dependent upon the individual's patient's needs. Usually a patient is attending 3-hour group therapy 3 to 4 times a week and individual sessions twice a month. In total, it's about a 9 to 12 hour a week commitment. Included in the intensive outpatient programming is case management, where the counselor will work with the patient to identify needed resources to help them along in their journey.
For patients assessed at OP level of care, treatment is typically 8 months in length. This includes group therapy sessions from either 2 times a week down to 1 time a month. This requires once a month individual therapy as well as case management services.
Family is a vital component of the recovery process. When you involve family in the patient's care, you're going to get the best end results. So the patient is held accountable, but then the patient also has someone that they can share, the highs and the lows of treatment with. Ashley has arranged for a family coordinator to reach out to the loved one or identified support person to tell them about Ashley, about the patient's individualized care, and give them education about recovery and about addiction. At times, we get patients who come in and say, I can do recovery on my own, I'm strong enough, and it's really important to recognize that it takes a team, it takes a family unit to recover, that no man is an island. So we want to remind patients that connection is essential, that sober support is necessary, and that you are not alone.
For patients who are needing resources or information, they can access this in the lobby of our outpatient facilities in our resource center.